When we think about the sympathetics, there is a central controller or a sympathetic output driver to this system of the autonomic nervous system. That output driver is going to be the hypothalamus, and we see the hypothalamus here more superiorly. It's above the spinal cord, and as a result, it will send out its sympathetic output to influence what is going on within the thoracolumbar area of the spinal cord. And by doing so, this is what will activate those preganglionic sympathetic neurons that begin their route out toward their distribution, toward their destination in the lateral gray horns. This output driver can be disrupted along the sympathetics, and if that happens, that can result in Horner syndrome. Horner syndrome would have to be a disruption of this sympathetic outflow, either at C6 here, could be out here at T1, and here's a disruption here, here, or here with the more superior cervical chain ganglia. At these levels, Horner syndrome will develop. If it's inferior to the T1, you can certainly have a disruption, but Horner syndrome will not be what you'll see in a patient. So what is Horner syndrome? Horner syndrome, as a result of this disruption of sympathetic outflow, will be characterized by the three OCs, or OSIS. One member of this family is ptosis. This is where the individual will have a drooping upper eyelid. Meiosis is where the individual will have a constricted pupil. And then the last osis here is anhidrosis. This is represented by an absence of sweating. A consideration or a cause of Horner syndrome, in addition to perhaps some lesions along the sympathetic output. This is fairly common when one is thinking about some exam questions that might be related to Horner syndrome. And this is where an individual could have a Pancoast lung tumor. A Pancoast lung tumor will extend between the lung itself and the posterior aspect in which the lung resides, along the posterior body wall, and can extend upwards here and start to involve sympathetic related structures that would then result in this particular syndrome.